Fit, we help manage your fitness centers. I know everybody who's logging on pretty much knows that. And our partners upstairs, or used to be upstairs, was Quad Med, who does all the primary medical care at General Mills. And we welcome Paul Linson to us today to talk about a very important topic and something that's hitting home for me as I just rounded the corner to 50 years old. So I think that makes me officially middle-aged now. But Paul's here to talk to us about men's health. And typically, my experience, I'm a physical therapist by trade. When I talk to people about following up with a primary provider, I tell them you need a point guard for your care, and somebody that can dish off to the specialist when needed or take care of things on their own. And how important that is. Men don't like to go to the doctor. They don't like to talk to about their problems, but Paul's here to tell us why that's probably not the right way to go about things, and that you should follow up on a regular basis. And we'll learn a little bit more how regular, how important that is to follow up with healthcare professional to guide your health going forward. So welcome, Paul. Thank you for taking the time today.
Thanks for having me.
So these Q&As, you guys, we want them to be somewhat of an open forum, maybe not somewhat off the cuff, but if you have questions, I'd love to see your face. Unmute or put your video on and ask a question. So interrupt us at any time. I have some canned questions that I'm going to ask Paul because I'm a curious guy as well, and I'm a musculoskeletal guy, so I don't know much about the other aspects of medicine. But if you have questions or you're shy, just put it in the chat box and I'll try to catch it. And I think Michelle's staying on as well, and we'll catch those as well as needed. But please ask questions. This is supposed to be an open forum for you to learn. I see a few frequent flyers with our Q&A sessions logging in here, so that's good. But Paul, can you just give us an overview of your background and what you offer General Mills employees?
Yeah, so I've been a nurse practitioner for about 10 years. And prior to this job, I worked in internal medicine, so pretty complex patients. And I was the procedure guy in our department as well. Skin exams, removals, biopsies, ER follow-ups, stuff like that, and just managed about 1,100 patients. And I got tired of working 80 hours a week. And so we changed. Now we get to do primary care stuff. We actually get time to visit with the patients. We're getting pressed to do so much so fast, and it just wasn't the right way to do health. And then 10 years before that, I was a nurse, worked ICU, cardiac ICU, ER, trauma, urgent care, kind of did everything. And now I'm in the right job because you actually get to have a conversation with your patients. I don't get clocked and paid by how many patients I see. I can actually spend time with them, more follow-up, more conversation. And it's been a really great thing. This is the way healthcare should be done.
Yeah. Well, that's great, and I agree with you. It is nice to spend time, and that's why guys like you and I got into the field. I think into medicine is to, as corny as it sounds, to help people, right? And oftentimes I think that gets lost on the business side. So it's nice to hear you say that. Paul, what's the difference between a nurse practitioner and a physician's assistant?
So a nurse practitioner, you have to be a nurse first. Has to be a 4-year RN degree, and then you have to have some places, depending where you go, between usually around 2 years of clinical experience, making judgments, seeing patients, taking care of people, and then you can go back for your master's. There's a lot of programs now where you can go straight through to DNP, to your doctorate, but I don't plan on doing that because I'm in a good place in my career. And as far as a nurse practitioner compared to like a PA, you can go into PA school with a biology degree, and it's 2 years straight through, pretty rigorous. And but there's no, as a PA, you are legally have to have oversight by a physician, have a tie to a physician. Whereas a nurse practitioner, once you've been in practice for about 1 year to 2 years, I think, you are technically independent. So in Minnesota, I don't have physician oversight. I'm independent. I can open up my own clinic, but my company requires the collaborative agreement because a lot of the states that they're in. So I don't mind, but they, it's kind of, I get to do what I need to, do what I want to, which is right. It's a lot more independence as a nurse practitioner.
Okay. So in short, you can do most of the things a physician can do and and a physician's assistant, but you have a little more autonomy than a physician's assistant. Is that correct?
Right. I do. I literally do everything. Right. And there are certain PAs. There's certain strengths that we bring as a profession. PAs are definitely get a lot more hospital time, procedural time, things like that. So when it comes to orthopedics and things like that, the PA, That's who I see. It's
Okay.
just kind of where our strengths are.
Good. Well, hey, just to dip our toe in here to our topic, can you tell me a little bit about, when you're in your 20s and 30s versus your 40s and 50s, how often should a male be seeing their physician, and how does that change over the decades, and what kind of tests that are required to give people the quote unquote once over for an annual exam?
Right. So it literally depends on what you read. I have practiced that every year everyone gets physical, and I even tell people, even though the guidelines in your 20s, healthy males say you can get your cholesterol checked every 5 years if it's good and you're healthy, you can get a physical every 3 to 5 years. But the thing that we're missing is for those guys who do pay attention to that and go every 5 years. Well, 24 to 32 is your highest risk of testicular cancer. So even though you're not going in, you're healthy and the risks are relatively low, it's still 1 out of 250 guys that get testicular cancer. And so we miss those things. And so in your 20s, and I tell people, in your 20s, start your yearly physicals. You're going for your kid exams as a child. As an adult, just keep it up. And insurance companies cover for that, because they would rather you be seen as a healthy person, because it costs them less money, than for you not be seen for 20 years and then show up with all these needs and medical needs. But so in your 20s, it's when I tell people to go every year. You kind of get into your 30s, you kind of start leaving that testicular cancer age group, and kind of get into that like 40-ish free zone. There's not a lot of other things specifically cancer-wise, and then you get into your 40s, and now colonoscopy like recommended at 45 instead of 50. You start looking at prostate in your 40s and 50s, and colon cancer, prostate cancer. But yearly, everybody should get a physical every year, especially because your insurance pays for it.
Okay, that's great. So, and I think that's sound advice, because I do think it's important to establish. I tell everybody about their primary provider that they want to go in and like seeing that person, right? Because that trust is very important both ways. And I tell people, if you have a good relationship with somebody, sometimes a phone call will go a long ways. But if they don't know you, they're not apt to write a referral for something if they don't know you. For something that maybe sometimes doesn't require a visit, and that's why I think it's important. So I think that's sound advice, and I really appreciate that. So in talking about I know that there's some new guidelines. I'm getting to a stage where watching cholesterol and blood pressure, but the blood pressure guidelines changed a year or two ago with what the AMA was requiring about what is prehypertensive. Can you talk a little bit about that?
So it depends on which year we do the review, which year the JNC makes up guidelines. It's been as low as 120/80, and then all of a sudden we're like, oh no, 140 or 90 is okay. And then we get that data between the 120 to 140 that says, no, we should actually be treating people a lot sooner for blood pressure, because they'll be on one blood pressure drug for a lot longer than if we wait 2 years or 3 years where they could have additional drugs needed. And so the guidelines do go up and down, but really, as of the last guidelines, about 2/3 of the population it's technically be on blood pressure medications. Even though we consider salt reduction, exercise forms of blood pressure management in that stage 1 even, but just shows a lot more people should actually be on blood pressure medication. But we don't jump to meds right away. I don't. It's just managing your risk factors, and the guidelines are important.
Yeah. And what about how important, and I know that everybody pretty much knows, and we'll get into diet a little bit as well, but how important diet and exercise are is to maintaining your numbers in a manageable level. But I see patients, sometimes young men that come in, and honestly, they are very fit, look like underwear models with their shirts off, and they're on blood pressure medication and cholesterol medication just because of family history. So how much does family history weigh into this, and how many of us can actually make a change by, which makes it more important to see your doctor on a regular basis, and have an annual exam with a nurse practitioner or a PA. But how do those factors weigh against each other? Just your genetics versus the external factors like your diet and exercise.
Well, it's always important. But if you see someone who comes in and they're 100 pounds overweight and they smoke and aren't eating well and aren't exercising, and they have genetics, well, clearly because of their current situation with their health, we're going to treat them anyway. Okay, but then you get into these, like you guys you mentioned, they're younger, fit, do everything right on blood pressure and cholesterol medications. The genetics can play a huge part. So identifying things earlier. And then with like cholesterol management and guidelines, we're a lot more aggressive as far as where we want those numbers to be and when, based on a family history. And for example, how old a sibling was, or a father, a grandfather, when they developed heart attack, stroke, kidney disease, diabetes, all these things. Their age and when they developed it plays a part in the bigger picture too. And we're just being a lot more aggressive because you weigh risk versus benefit of being on the medication, versus if we wait 10 years and we keep watching and watching and watching and watching. Well, how long do you watch something till you actually pull the trigger? Meanwhile, if you watch for 10 years, that could have been 10 years of risk reduction because you were on a simple, cheap, generic, low chance side effect medication. It can really lower the risks. So I do go pretty aggressive when you have that type of gentleman.
Okay. Great. And I think that, like I said, when seeing these young men that come through sometimes that don't, on paper, what I mean is looking at them, look like they're very fit, but are still on those meds. It just echoes what you said about following up with somebody on a regular basis. So I think that's important to know. Can you talk a little bit about, at the same token, kind of recommendations that you give to your typical patients regarding diet for men, and I'll emphasize the middle-aged men, because I think that's when we start paying attention more. I think, because let's face it, in my 20s, I could eat and drink whatever I want. I had time. I didn't have a family, so I had time to work out 2 hours a day. Once you have a family and kids at home, and your time gets precious. And we shouldn't do this way, but I've experienced it myself. It's like, you should find time to exercise and do everything right. But tell me a little about how diet can play an impact.
Well, it's crazy how our medical problems today can be so much traced back to diet. Like we're doing colonoscopies now for guys at 45 because we're finding more and more people are having colonoscopies for bowel issues, and they're finding polyps early. Well, a part of the reason we're finding polyps and the change because of a change in GI functions, because we're eating crappier. In general, high meat diets, high fat, low residue, low fiber, crappy, not a lot of grains, is a risk factor for colon cancer. So yes, there's a tie to diet when it comes to inflammation. Eating, drinking diet sodas, fast foods, all these things. You are what you eat, and I'm a huge proponent of everything is okay. It's just in moderation, and that's where people kind of get lost. Like, I'm eating a healthy salad, yes, but you had 4 eggs on there, you had too much dressing, and the salad was 2 portion sizes, and you didn't have any meat on there. So it's all those little tiny things that we think about. And when you look at diets in general, whether it's Atkins, keto, whatever type of diet a person is doing, the common denominator is less desserts and no junk food. So you do a diet specifically to lose weight, you get to that point, but then you stop the diet because you got to your goal, well, then you're going to get it all back. Whereas if you adopt the diet that says, I can have tater tots on Wednesday at General Mills for lunch every Wednesday, which is one of my downfalls, you can do those things, and then you don't feel bad. Because if you do an elimination diet, you're going to fail, because it's just, everybody should be able to, you should enjoy pizza, enjoy a nice beer, a nice glass of wine, enjoy good foods, but just don't have tater tots every single day of the week. It's all the moderation is really a lifestyle that you have to be really have control over. And that's the most important thing, is just eating a balanced diet, so you get all those fresh things as opposed to just all processed and fast things.
Okay, sound advice. And I want to just, on this note, we're rounding the corner, about 10 more minutes here, and I have some other questions for Paul, but please chime in if you have specific questions. And again, we'll share Paul's contact information at the end, and when we upload this to our YouTube channel, so that you can reach out to him as well. But Paul, talking about moderation, when I talked to my doc, we talked a little bit about last time I was in there, and I'm due myself, so this talk is very timely. He talked about how you see people get heavier because of these craft beers. He said, we were raised on like having a couple of Miller Lights, and now you're going to have a couple of hazy IPAs, and they're 16 ounces, not 12, and they're loaded not only with more calories but more alcohol. So what are the recommendations around, let's face it, all guys like to have a beer or a whiskey. What are the recommendations around drinking?
So it depends on if you're, there's guidelines that say, talk about, a glass of wine a day to reduce your cardiovascular risk. There's, drinking wheat beer is more calories than drinking a Miller Lite. And so a drink a day is fine. A drink, maybe 2 drinks a day based on how active you are. If you're not active, don't do alcohol. It's just kind of a compounder to what you're already not doing, because when you're active and exercising and the rest of your diet is pretty balanced, it's easier for you to take in the calories, to process it, to detoxify the alcohol. And so as far as calorie consumption for energy and those things, your body will balance better if you're active, more exercise, eat better. But if you're not, and then you take the alcohol in 1 to 2 a day, it's different than if you were healthier. And then you add in, like you said, the higher alcohol content, just a bigger portion, which is with it just makes it harder on your body. So 1 to 2 drinks a day, one is best, and none is actually the best. We would all do much better if we didn't have any, but a drink a day is absolutely fine.
Okay, well, great. That's wonderful. And I have some questions surrounding that, but Jay just put a question in here about and I'm assuming because of COVID, doesn't feel safe to go to the doc for a simple annual checkup, and he's wondering, is he okay postponing it till next spring?
Yes, so it just depends on your medical history. If you're on blood pressure medications and you have diabetic medications or those, no, you shouldn't wait. If you're healthy, you're up to date on all your vaccinations, your cancer screenings like colonoscopies if you're due. Every year your physical is kind of like, well, my numbers are good, here's this, here's that, I'm doing this, and you're doing everything right, then I think that's reasonable to wait. That being said, which we have a lot of people who see me, there's several hundred a lot of them are waiting, which is acceptable based on health. But know that, like the General Mills, this clinic is the only quad medicine clinic not open. Clinics are open, and they have guidelines in place for just like everywhere else. Minimizing people in the room at the same time for lengths of time. Like some places you may do everything online, all your history review, your conversations, everything. You literally go in when the timing is right, waiting room, have your physical, you're in and out in like 5 minutes. So there's a lot of ways that companies have tried to mitigate the risks, and then you go in and you're wearing a double mask, and the provider coming in is all up in their spacesuit gear, and it's safe. That being said, numbers are changing. But if you're healthy, you're fine to wait. That's the point of that.
Okay, that's great. Thanks for the question, Jay. And also then, just along the lines of the going back to the alcohol, and I have a couple more questions about some of the topics that are near and dear to your heart as well and are hot topics. But with the drinking, so it's not advisable to drink a day and not having them during the day, every day of the week, and then catching up on the weekends. It's probably not okay to do that.
That's a really good thought.
Okay.
All right. To that.
So Paul, I know that you have a special interest in some specialized training in CBD. Can you just give us an overview of what CBD is, and is it more anecdotal evidence? Is there science behind this, and who might benefit from CBD?
So CBD, all the data we had up until about 15 years ago was from the tobacco companies, started in the 60s and 70s, and all the information we had was bad. It was labeled pot, weed, hash, anything else, just to make it look bad. And the tobacco companies made tobacco look good, and kind of look where we're at now. But after doing more research, privately funded, because it's still federally illegal. It's illegal in states based on their own laws. Certain versions like Minnesota hemp or CBD is now legal to sell. You think of CBD as like, the castle movies with castles. There's always one master key that locks all the doors. That's what CBD is. There's a couple different versions of CBD, and it's the goal is you put the CBD goes into a receptor site to cause an action, and it works in literally pretty much any cell. THC is specific. That's the part of the marijuana that can make you high, and the CBD and the balance of THC together, when we can manipulate those now to benefit certain health conditions, sleep apnea, seizures, chronic pain issues, PTSD, anxiety, autism, like MS, ALS, all these movement disorders. We know that we can augment the body's normal response to what it's normally supposed to do, and it's just fallen by, just not as good as it used to be for whatever the reasons are, when a CBD with combination of THC in some occasions can really augment what your body is already supposed to be doing and give people pain relief and release reduce anxiety and PTSD symptoms, and help pain with people with MS and all those things. And I certify people on the side, and it's the research is done privately because there's no federal funding for it. It is all out of pocket when you are certified, but the data is crazy. We have an endocannabinoid system in our body, just like we have an endocrine system that manages our hormones. We have an endocannabinoid system in our body that reacts specifically to THC and CBD. So it's a pretty awesome system, and research just continues to be ongoing.
So, and I didn't know this. So sometimes the CBD, they do keep a little of the THC in it. And for people that don't know, that's the active ingredient that makes you high in marijuana. But they will, depending on the situation and depending on the diagnoses and what you're trying to achieve with the therapy, they might put the little THC in there as well.
Yep. And so you want the benefit of the THC, but you want to be able to drive. Okay, so the CBD, once it locks into the receptor site, actually blocks THC from going where it wants to go, which is the high part, the psychoactive part, but then still give you the benefit of feeling more relaxed, calm down a little bit, slow your brain down, slow your breathing down, relax your muscles. So that's where we get into the ratios, and that's what makes a difference. And it's actually pharmacists in Minnesota that do it at the dispensaries. They talk with you, help you decide based on research what products and what ratios are best. But yeah, it's great. We can manipulate it. It's awesome.
Oh, that's really neat. I really did not know that at all. And I don't know a ton about it. Now, is there solid science behind this as well, or is stuff pending right now? Is it more theory and more anecdotal evidence right now?
So the data behind it is not like we're going to get a blood pressure pill approved by the FDA, because it's been researched for 5 to 7 years, and 95 times out of 100 it does the exact same thing in all different scenarios and situations. It's more that it helps enough people to say this is worth researching and understanding better. And it's not like it helps 1 out of 10. We're talking in some cases, 7 or 8 people out of 10, which is data significant enough to try and figure out why it's working and valid and worth trying as another method of trying to get different outcomes. So there's a little girl, her name is Charlotte Fiji, F-I-J-I. She died recently. She's the reason I got into medical cannabis. And so I encourage you guys to look her story up online. It's a little girl who had seizures. They were on so many meds, and then the family decided to do medical marijuana, and she was like a different kid. It was crazy. It's just a great story.
Hopefully Michelle can link that up on the description when we upload. So that's great. I don't know a ton about it, and I get people asking me. I should educate myself a little bit more too. So I appreciate this initial conversation. Paul, we have a few minutes left, and to the participants here, please ask questions. Paul, can you just touch on COVID and how, we know the importance of wearing masks. These epidemiologists, virologists, and infectious disease docs, everybody says that's what we need to do. But outside of wearing a mask, what else can we do to help prevent, transfer of COVID and keeping ourselves and our families safe?
So mask is the big thing. Obviously, following their guidelines of limiting people in space based on time with people in a closed environment. Being outside is still one of the best things you can do. Just be outside. With the environment now, being outside with a mask is best, but just where the environment can reduce some of the concentration if it is coming out from people. But there's not a lot of other data that suggests that there's ways to prevent it. Okay, so there are ties to people with low vitamin D who might have a worse outcome or do worse if they get COVID, or even finding that they have a higher chance of getting COVID. But then we also know that more typically people who have low vitamin Ds have more chronic medical issues. So where that balance is, we're not really sure. So does vitamin D taking it actually reduce the risks you're going to get it? No. But for the healthy person, it has shown some promise that it's reduced symptoms and how long you've had symptoms and post-symptoms. Like vitamin C, average is you just need 100 a day, 100 milligrams a day. But you see these vitamin supplements, immune powders are 1,000 or 2,000. We know vitamin C helps skin. It's an antioxidant, boosts your immune system. Does it actually affect and help COVID? No, necessarily, but we know that it's good for the immune system. Same thing with zinc. Nothing proven that any of those prevent. Certainly those are part of the immune system. So if you think logically, could those help? Sure. Is it going to prevent it? No.
Okay.
Wash your hands, wear your mask.
Stay outside.
Stay outside.
Right. Well, I have one more question that came through here, and then I want people to I want you to tell people how they can get a hold of you, and not just males in the group here, because the majority of males on the call, but females as well, how they can get a hold of you to get in touch with you for some treatment at General Mills. But any tips to fight the winter blues from a diet perspective? Trying to go outside as much as possible, but the weather in Minnesota can be brutal. And I would tell them, get tough. No, I'm kidding. But what can you do from a diet perspective, maybe?
So from a diet perspective, stay away from fried foods, fast foods, get your fruits and vegetables. Like you got to get the benefits from the things that can augment our body's overall function. So there are mood foods, like people have heard of oysters for, like I said, aphrodisiac. I mean, there are foods. The bottom line is, like I've said, it's balance.
Yep.
Baked foods, not fried foods. When you get into specifics about like which foods and not, I mean, there's a lot of data that suggests certain things, but nothing that's been proven. Kind of like a lot of other things that we do. But I always fall back on eating balanced. Eat your fruits and vegetables. And for people who, when you're stuck inside, there is research behind like being on a screen, and headaches and mood is like blue glasses. You're getting a screen, blue light blocking a screen, and then also things like a daylight lamp. You can sit next to your desk just 15 minutes a day. The daylight lamp specifically, that has data supporting people, boosting their moods, and helping with the winter blues, especially in this time we're inside even more with COVID. It's just, it's your time. But as far as that goes, I don't have a specific. It's about the diet. It's about the diet. Did I mention it's about the diet?
No, you didn't. Okay, gotcha. Well, Paul, thank you so much for taking the time. We're getting close to the end here. How can people get a hold of you if they have questions or want your services?
So you can email me, certainly. It's P. Linson at Quad Medical. That'll be on there, I'm sure. Also, you can, if you go to the QuadMed website, you can sign up for a MyChart account. Directions are on there, and then you'll be able to send them a message, which sends me a message, and once we're connected, then we can visit through MyChart. Same MyChart app that Park Nicollet has, and Fairview. It's the same thing. Calling the clinic, it goes to a call center since we're closed, but then they always forward me the message, so I will get that too. But we're still here. We're still here, be able to help, still doing visits. So we're still here to support you guys.
Great. Well, Paul, thank you so much for taking the time. Thank you for all the participants for logging in. If you have other questions, Michelle has everything up to get a hold of Paul. And then our next Q&A session, Paul, you feel free to log in, we're going to talk about snow shoveling safely on December 9th with some TC Fit physical therapists. So we'll hope to see a lot of you then. Until then, stay safe. Thank you.
Have a good day.